As part of the assessment at Benenden Hospital, you'll come to the hospital, you'll be asked some questions by the nurses and have some tests performed. Some of those tests you'll be familiar with because you have them performed when you go to the opticians, like reading the letters on the chart. Others you'll be less familiar with, but I'll give some examples here. Now you can see we initially start with what we call cornea mapping. So the cornea is that clear window at the front of the eye, and we take a rotating photograph of the cornea. And we do that so that we can ascertain how thick the cornea is and the shape of the cornea, because that's going to help inform our choices as to what lens at the time of cataract surgery we might suggest to you. Now, this is the screen that we see, and we can see the shape of the cornea. We can see how thick the cornea is, and we can see the depth of the front chamber of the eye to help with our cataract plan. Here you can see that these circles are projected onto the cornea, and this is a technique to enable us to work out the shape of the cornea. So if you project circles onto the cornea, if it's irregular or steep in one direction and flat in the other, it will distort these circles and it will give us an idea of the shape of your cornea. So when the cornea is misshapen like this, so steep in one direction and flat in another, we call that astigmatism. Now, astigmatism is important because it degrades your vision, so your visual quality is not quite as good. And we can correct that during the cataract surgery and provide lenses which will give you an optimal outcome. As you can see here again, this test merely involves you putting your chin on a machine and having a light shone on the eye. There's no touching of the eye or anything like this. This is a picture of the eye with the circles superimposed on the surface. And you can see that there's some distortion of those circles. And that helps us work out in our planning, which goes into a formula to work out what style of lens that we can offer to you. We'll move on to the next slide. Now, once we have all of those images, those are passed through to the surgeon. You can see at the bottom here is the images that have just been performed on the patient before. And we get 4 maps. This one is the curvature of the cornea. This one is the front steepness of the cornea, the back steepness of the cornea, bottom right, and the thickness of the cornea. Now, these are relevant to us because you can see on the top left map that there's a sort of increased red color in this direction here, but a yellow color in that direction there. And this equates to this scale here. So the red areas are curved, steeply curved areas, and the yellow area is a flat curve. Now that's the astigmatism. Now those readings can then go into a formula up here, along with the length of the eye, the curve of the eye, the front depth anterior chamber, and it goes into a mathematical formula, which then gives us the power of the lens that we would need to order and then implant during the cataract surgery and the expected outcome. Now, all of these measurements are performed with something called biometry, which uses laser and a special light, infrared light, to measure the eye. And this all takes less than 1 minute to do. So I'll show you a demonstration of that. Now, this equipment is very expensive and has been purchased by Benenden within the last year. So you can see the eye up here, and it's projecting dots onto the surface to measure the curvature. You can see the front chamber of the eye here. This is the pupil. This is the lens or the cataract when it's gone clouded. So that's all the first measurements done in under 20 seconds. We then move on to the other eye. This is all done automatically. Again, measuring the curvature of the eye. This is the front chamber of the eye. This is the cataract. This is the pupil. And you can see that all of those measurements are done in just over 30 seconds. The computer then calculates the power of the lens. All of this is done without touching your eye, just with lights. And that's all done in less than 45 seconds. So very quick, very simple. It's multiple repeat readings, so it's very, very accurate, the latest equipment available, and very simple. Now, after we've had all of these assessments and you've answered the questionnaire so we can understand what your needs, your visual needs are, and what your pastimes are, we then move on to a consultation with the surgeon, like me, who would examine the eye to make sure that your eye is healthy. But particularly, we're looking at the front chamber of the eye. We're looking at the cataract if the lens has gone cloudy, and the health of the back of the eye. Now, a cataract is when that usually clear lens becomes cloudy. Now, the symptoms that you may suffer from due to cataract would be that the vision becomes gradually blurry, or the image becomes very washed out and yellow, or you get a lot of glare, depending on where exactly the cataract is within the lens. Different people will have different symptoms. The procedure itself at Benetton is predominantly done with local anaesthetic. That means eye drops only. So 99.99% of cases are performed with eye drops only. So you have eye drops to numb the eye, a drop to clean the eye, and a little pellet is placed just inside the eyelid, which releases medicine over about 30 minutes to help the pupil dilate. Then during the procedure, you're sitting in a chair that reclines like a dental chair, and we clean around the eye with iodine, and we cover the lashes with a drape, and there's a little clip to keep the eyelid open. You're then asked to lie still and to stare straight ahead at a bright light. And then during the procedure, what we do is we make a tiny incision on the edge of the cornea, which is 2.2 millimeters wide only. We then fill the front chamber with an artificial jelly to maintain the depth of the eye. And we make a little circular opening on the front of the cataract. We then use a machine called phacoemulsification. Now, this machine produces sound waves, which break up the cataract, and it also has a vacuum to aspirate away the cataract segments. And that then leaves an empty capsule bag inside the eye. And into that capsule bag, we inject a new plastic lens. So that plastic lens is made from a malleable acrylic, which rolls up into a little cartridge, like a cigarette paper. And we simply inject that into the eye. And once it's in the eye, it unfurls inside the capsule bag and is held in place by two little arms that we call haptics. And at the conclusion of the surgery, we put antibiotics into the eye and take away the drape and the clip, and the surgery is all finished. For those patients who have decided that they'd like to get both eyes done on the same day, then we will then move on to the other eye, and the same procedure is performed again. This is the machine that removes the cataract. It's called a phacoemulsification machine. At Benetton Hospital, we have the latest generation of that machine called the Centurion, which is produced by an American company called Alcon. It's the latest machine because it has a pump inside there, which is controlled by 3 sensors in the tip of the phacoemulsification probe, which then dictate how these pumps in this computer segment here work. And these are set by the surgeon, so we can set the pressure inside the eye and the power of the vacuum, and also the power of the ultrasound that breaks up the cataract. This machine was developed by Alcon, and there's a big international body of consultants who advise Alcon on the machine and how to improve it. And you can see that this is me at the back here as part of that panel to provide the best machine possible for you, potentially, if you come to Benetton Hospital. Now, when we take away the cataract prior to becoming cloudy was a clear lens which helped you focus your vision. Once we remove that cataract, you need to have a replacement lens for you to be able to focus your vision again. Now, those lenses come in different styles with different advantages and compromises. Most probably the commonest intraocular lens which is used is something called a monofocal lens, or a standard lens, which would be commonly used in the health service. And that lens is a very good lens, but it has limitations in that the focus is only at one plane, which is for most people usually in the distance. And then they would need to use glasses like multifocal, like varifocal glasses to be able to read up close or in the middle. And for people with astigmatism, it wouldn't correct that, and therefore they would need glasses all the time. At Benedum, we can offer other lenses, which we call premium lenses or special lenses, including multifocal lenses. You can see on this multifocal lens that there's a number of rings, and those rings allow you to focus up close, in the middle, and in the distance. So you're less reliant on spectacles. This is a close-up image of those lenses. So you can see faint milled circles on the lens. So the advantage of that is distance, middle, and near vision. But the compromise with these lenses that when you look at bright lights in the evening, you may see some circling around lights. And in low levels of light, it's a bit more difficult to read. So you need to turn the lights up. But nonetheless, these are a very popular lens and have lots of advantages to them. And if you're happy with the compromises, then it may be the lens for you. The lens itself, this graph is a bit complicated, but basically it shows that the light from a multifocal lens is split into three, so a trifocal lens, predominantly in the far vision and in the near vision. So it allows you distance and near, the near being about 40 centimeters away, with some intermediate vision, so approximately at the distance of your laptop from your eye. So it gives functional vision for what most people do nowadays, which is look in the distance when they're driving, look at their laptop when they're on the internet, and when you're reading a book to be able to read up close. This is a different lens, but of similar outcomes, which show that most people who have multifocal lenses, who are being counseled properly, preoperatively to expect the compromises and the advantages, would elect to have the implanted lens again, and there's a very high satisfaction rate with those lenses. Post-treatment, you're immediately as you finish, it'll be a bit it'll be blurry, but not so blurry that you can't walk around and navigate. You're provided with refreshments, so tea or coffee or whatever you need, and biscuits while you watch a video on your post-operative care, which involves eye drops for 1 month to keep the eye uninflamed and clean with antibiotics. You're phoned later by our nurses to make sure that everything's okay. And with the special lenses, you come in to see our optometrist to check the outcome of the lens. And this is what we see when we're looking down the slit lamp. You can see this is called a retroillumination photograph. So the light enters the eye, bounces off the retina and comes back and enters the camera. And then you can see that this is the edge of the lens here. This is the dilated pupil. And you can see the faint circles on the lens, which indicate that this is a multifocal lens. But it's nicely centered and no issues at all there. This is a closer view of that with an oblique light. You can see those circles on the lens, which give the multifocality, but it's well centered. This is the dilated pupil and everything looks fine.